Hello everyone, my name is Elizabeth Hayes. Today I'm going to be talking about deaf and hard of hearing. This presentation is primarily geared towards parents who may have had a diagnosis of deaf or hearing loss for their child, or they have a concern about their child's hearing. I will be discussing the types of hearing loss, how important early detection and intervention is, the developmental milestones to look for, and warning signs that your child may be experiencing a reduced or loss of hearing, as well as discuss what to do, who to contact if you have concerns. I have included some resource books for parents as well as books to use with children at the end. So let's get started. So what's the difference between deaf and hard of hearing? Deaf is hearing loss that is so severe that there is very little to no functional hearing. Hard of hearing refers to a person with mild to profound hearing loss, where there is enough residual hearing that an auditory device such as a hearing aid or FM system provides adequate assistance to process speech. The term hearing impaired can be considered offensive, as if there is something impaired, broken, or that they are not whole. So deaf and hard of hearing is the preferred terminology. The results from a hearing test, known as an audiogram, documents two important types of information: frequency, which is the range of sound, such as pitch, and decibels, which measures the loudness from very soft, 5 decibels, to very loud at 110. If an individual has a hearing loss exceeding 90 decibels, then they are considered deaf. If the loss is less than 90, then they are considered to be hard of hearing. There are many causes of hearing loss. I will provide an overview on the types of hearing loss. Hearing loss can be present at birth or may develop later in life. There are congenital, acquired, and transient types of hearing loss. Congenital hearing loss is present at birth. There are so many possible causes. Sometimes it can be difficult to identify the exact cause. Some possibilities are birth complications, premature birth, genetic and hereditary factors, maternal illnesses, just to name a few. Acquired hearing loss is just what it says. It is hearing loss that happened or was acquired after birth. Again, there are so many potential causes, such as a perforated eardrum, serious head injury, exposure to loud noises, untreated and frequent ear infections, exposure to secondhand smoke, as well as due to infections such as meningitis, whooping cough, just to name a few. Another type of hearing loss can be transient, which means it can come and go or fluctuate. It can also be detrimental to your child's speech and language development. Remember, if your child cannot hear the sounds, they will not learn to make the sounds. This is important to keep in mind when we discuss the importance of diagnosing any loss, as well as seeking out speech and language therapy to help make speech and language goals in order to help your child communicate effectively with others. Transient hearing loss can also be caused by middle ear infections. These types of ear infections are very common in children. When they have colds or are congested, the eustachian tube and nose can become blocked. Fluid can build up and prevent the ossicles from vibrating normally. They have fluid in their ear and they may exhibit no symptoms. While usually reversible if treated, hence the transient hearing loss, they can fall behind in speech and language development. When middle ear fluid persists for an extended period of time, such as months or years, it can lead to irreversible hearing loss or chronic ear infections. Sometimes doctors may suggest putting tubes in their ears to allow that fluid to drain out. The importance of early detection and intervention. Speech, language, or hearing problems can lead to trouble making friends and doing well in school. You want to give your child success and get help early. Hearing ability can impact your child's development and ability to communicate. It is important for speech and language skills. The earlier any hearing loss is diagnosed, the better it is for your child. Research shows detection and intervention for hearing loss prior to 6 months of age results in significantly better outcomes than intervention after 6 months of age. Newborn screening tests have become universal in hospitals across the U.S., and hearing loss are being identified and treated at much younger ages. But if you suspect your child is having trouble hearing, what do you do next? We'll take a look at some of the important speech and hearing milestones in children so you can see what typical developmental signs are in order to help guide you if there is a concern or not. It's important to note that children develop at their own rate. This chart tells you what most children who speak only one language will reach each milestone. Your child should master the skills listed by the time he reaches the top of the age range. Missing one skill in the age range does not mean he has a problem. So when you look at from birth to 4 months, your infant should startle at loud sounds, wake up or stir at loud noises, respond to your voice by smiling or cooing, calm down at a familiar voice. From 4 to 9 months, you should see your child smile when spoken to, notice toys that make sounds, turn his or her head towards sounds, and make babbling noises. From 9 to 15 months, they should be making various babbling sounds, repeat some simple sounds, understand basic requests, use his or her voice to get your attention, and respond to their name. From 15 to 24 months, some signs you should be seeing is they use many simple words. They should be able to point to body parts when asked, name some common objects, listen with interest to songs, rhymes, and stories, point to familiar objects you name, and follow basic commands. Some warning signs in older children you want to watch for is difficulty with understanding what people are saying. They speak differently than other children their age. They don't respond when you call their name. Turns up the TV volume so high or sits very close to the TV to hear. They may have problems academically, especially when they weren't present before. They might have speech or language delays or problems articulating things, complains of ear pain, earaches, or noises, says what or huh several times a day, and watches a speaker's face very intently because children learn to become lip readers when they can't hear.
1, 2, 3, 4, 5, 6, 7. Aha! You're on my apartment building on Granite Avenue. You owe me $300. Get it up?
Fred, take it easy. It's only a game.
Wilma, I'm just like them big tycoons. I play to win. Now, Barney, pay up or get out of the game.
That's 1 down and 2 to go. Betty, it's your turn.
I don't have any more money either. You got it all.
Then I'll take a mortgage on your open home. Well, come on, take the bank, will you? Don't just sit there like a dummy.
I will not have you talking that way to our guests. Come on, Barney. I think we'd better go home.
So what do I do next? First, you want to contact your pediatrician. They can refer you to a pediatric audiologist to have your child's hearing tested. If a child has wax buildup or an ear infection, the audiologist may refer you to an ENT, also known as an ear, nose, and throat specialist. And you want to get a complete evaluation. So you want to first find out if your child has any hearing loss and talk with doctors about any medical interventions necessary. Then get your child evaluated for any speech and language therapy that may be necessary to help your child effectively communicate, and work on specific goals in order to ensure your child is meeting any and all developmental milestones, especially in the area of speech and language development. When I say get a full evaluation, these are going to be just some of the key players on the diagnostic team that will help determine what your child's strengths are, as well as what areas are of concern. Let's talk about the different people that may be involved on the diagnostic team. The first is the pediatrician. They will evaluate for general health problems. The otologist or an ENT determines any medical cause for hearing loss and determines if loss can be medically or surgically treated. The audiologist initially determines the type and degree of hearing loss, evaluates the child for amplification such as hearing aids and FM systems. A speech and language pathologist evaluates language understanding, expressive and speech clarity, as well as provides therapy to meet goals and monitors progress. The earlier therapy begins, the better the chances are that they will develop oral language and speech skills. Okay, so you've gone to the doctors and your child has been determined to have a hearing loss. Now what? Now it's time to reach out for getting your child evaluated for any speech and language therapy necessary to help your child communicate. We talked about the speech and language pathologist's role earlier, and they are a part of a team that will give your child a complete evaluation in all areas of development that may be a concern. So where do you reach out to? If your child is under the age of 3, you want to contact early intervention. Early intervention is a system of services that helps babies and toddlers with developmental delays or disabilities. If your child is of school age, contact the school with the results of your medical and audiology reports. They can help guide you and determine if and what tests need to be done at school in order to make sure your child's educational needs are being met. Do your research and know that you are your child's biggest advocate. You know your child best, and you are a very important part of the team. These are some very good parent resource books that you might want to check out. And these are some very good children's books centered on deaf and hard of hearing subject. So that is an overview of deaf and hard of hearing and what you should do if you have concerns for your child. And these are references of where I got my information, and there's a variety of other references available on the internet. Thank you very much.